In your morning medical news, if you're using acne treatments from Proactiv or La Roche-Posay, you might need to check your medicine cabinet this morning. The FDA says 6 popular products are being recalled after testing found elevated levels of benzene, a chemical linked to cancer. Affected brands include Proactiv, La Roche-Posay, and Walgreens store brand. While benzene exposure can increase cancer risk, the FDA says your danger from using these products is very low. Manufacturers are already voluntarily pulling these items from store shelves. And the FDA issuing its new flu vaccine recommendations. The agency says vaccines for the upcoming season should be trivalent. That means protecting against 2 strains of influenza A and 1 of influenza B. The agency's decision comes from a group of some of their own experts, some from the CDC and some from the Defense Department. Some encouraging news about young Americans' mental health this morning. The Economist found that depression rates dropping across multiple surveys. Young adults reporting weekly depression fell from 16.5% to 13.3% last year. Fewer teens also saying that they don't enjoy life, and college depression rates have declined since 2022. How often do you actually get a full 8 hours of sleep? I won't answer that. A new survey shows most Americans are missing out on their shut-eye. On this World Sleep Day, Michael George shows us what we can do to try to fix that.
Like most college students, for Izzy Peterson, sleep is not priority number 1. Do you get enough sleep?
I don't think so.
And firefighter Stephen Camillo says in his line of work, getting 8 hours of sleep a night just isn't realistic. Typical night, how much sleep are you getting?
I guess we get like 2 to 3 hours.
2 to 3 hours.
Yeah.
A new survey by the National Sleep Foundation finds 6 in 10 Americans aren't getting enough sleep. And sleep expert Joseph Drzewski says it's taking a toll.
Adults with poor sleep health were 2 times more likely not to be productive at home, 2.5 times more likely not to be productive at work.
People who do get 7 to 9 hours of sleep a night report performing better at work and had better physical and mental health. Those who don't are feeling the impact.
I feel like I'm less productive. I get stressed out so much more easily. I get emotional a little bit.
I'm usually like cranky. I just want to sleep. I don't want nobody to bother me.
Here's a few things sleep experts say we all should be doing. Get exposure to bright light in the morning. Get daily physical activity. Eat meals at consistent times. At night, avoid heavy meals, nicotine, alcohol, and caffeine. Go to bed at a consistent time in a place that's quiet and comfortable.
Sleep is not something that we simply do when there's nothing else to be done. It's a core, critical part of our day that sets us up for success in everything that we do.
More and more evidence that we can't have a good day without a good night.
That is a very true statement. And it's not just for your health. People who get a good night's sleep every night also reporting that they have more fulfilling social lives. A vacant hospital in Chippewa Falls could soon reopen to serve patients again. The Chippewa Valley Health Cooperative signing a purchase agreement for the former St. Joseph's Hospital. The group now has 90 days to determine if reopening is financially viable. If approved, the facility could welcome patients as early as winter. St. Joseph's Hospital closed its doors last March, leaving a gap in local health care.